Israeli Prime Minister Benjamin Netanyahu says Israel will carry out an operation in the southern Gaza city of Rafah, even if there is a ceasefire deal with Hamas. More than half of Gaza's population of 2.3 million people has been sheltering in Rafah from the war. Aid agencies have warned that a military offensive there could be catastrophic and would result in large-scale civilian casualties. Bob Kitchen joins me for more. He's the Vice President of Emergencies at the International Rescue Committee. Bob, thank you for being with us. You recently visited Gaza. What did you see?
Well, I saw intense overcrowding and a public health emergency waiting to happen in Rafah, the southern city. People are living everywhere, in tents set up in the median of streets. They're living in unfinished buildings literally everywhere. Right now, Rafah is more than twice as densely populated as New York City. And with city services offline, there are mountains of trash and rivers of sewage flowing everywhere. So those and the fact that there's not enough water and nowhere near enough food results in a real clear and dangerous mix that's already driving a desperate humanitarian situation.
And you mentioned that, I mean, how would a potential invasion of Rafah worsen what you've already just described? And what are people's fears about what could happen with an offensive?
Well, there's a tangible sense of panic. I heard from many people in Rafah who have heard Prime Minister Netanyahu announcing that the offensive will proceed, that a date has been selected with or without, just as you said, a deal or a ceasefire in place. So the civilian population haven't been told where they should go, and they know that nowhere is safe in Gaza right now. And aid organizations like the International Rescue Committee, we've not been told where to plan, how to get ready and where to get ready to accept 1 million people who are going to be displaced again. The offensive will cause tens of thousands of more people to be killed in fighting, and we fear many more will die through displacement and the public health emergency that will come with it.
On Monday, Secretary of State Antony Blinken said the U.S. has seen, his word, measurable progress in the humanitarian situation in Gaza. Help us understand, or help us evaluate that statement in terms of the scale of aid coming into the territory as you see it.
Well, I think it's way too soon to celebrate. We've seen a slight increase in the average of trucks crossing per day, but still, with even the 10 or 15 more trucks, we're still seeing well under half the number of trucks that crossed the day before the war. And the population wasn't facing a famine then. They didn't need to recover from a famine then. So the number of trucks crossing is only also part of the story, with 40% of aid convoys requesting permission to travel inside Gaza being turned down by the Israelis. So there is really only a trickle of aid still getting through to people who are starving, who need water, and we really need to work to increase that to a sustained torrent of aid. So way too soon to celebrate.
Israel is denying reports of multiple mass graves found at multiple hospitals in Gaza following the Israeli military's withdrawal. What do you understand of those reports of those mass graves based on your information?
Well, I can tell you that we were tracking doctors and patients in Al-Shifa, and we've lost touch with them. I can tell you that patients arriving from Al-Shifa to our doctors in the middle area have told us horrible stories of seeking permission to access the bodies of their loved ones who were killed in the hospital, only to be told to stand back and watch as forklift trucks and excavators buried bodies on top of bodies in shallow graves. And I can tell you that our staff and partner organizations in the UN have confirmed that many of those bodies were naked and they had their hands tied behind their backs when they were shot. So these are gruesome accounts, but they're only one sliver of what has been happening across Gaza over the last 6 months.
Bob, as a final question, the IRC does work all over the world. Help us understand or put in context the complexity of this rescue operation and in Gaza.
Well, the IRC works in 40, 50 countries around the world, and I've been doing this work for the last 25 years. I've worked in all of the major war zones. I've never seen another conflict where 2 million people are cornered, slaughtered, and then starved in such a coordinated way. The constraints on aid getting in and being distributed, the safety or lack of safety for aid workers, all of this being piled on top. It's a unique and terrible situation that can't be allowed to continue. We need a ceasefire immediately.
Bob Kitchen with the International Rescue Committee, thank you for being with us.
Thank you.